Good afternoon. This is Dr. Bill White again, and I'm going to be talking to you a little bit about cysts, and this time we'll be talking about the fast method of dealing with them. Uh, we covered the slow method in another video, and you can compare the two and see what you think is best. This one, we sent the patient to an oral surgeon, and he uh, proceeded on the whole thing by himself, and he took some pictures of it and gave them to me. And so this is what I will be showing you, is the pictures that I was given by the oral surgeon that he took, except this, the facial pictures and things that I took in the office. And this will be in contrast with the slow method that we covered earlier on. So we'll go through this pretty quick. This is a young lady that had a rather large cyst on the lower right jaw, and you can see some enlargement of the jaw tissue over on the right side, but not really a great deal. But anyway, the cyst is rather large, and it's in the corner of the lower right jaw, and it has pushed the second molar up underneath the 6-year molar, and there is no wisdom tooth. Now, the slow method that I used, probably we could have saved that second molar, but I don't know that to be a fact, and the oral surgeon felt that he had to take it out to be able to get all the cysts out. So anyway, here it is. Now this is a deciduous tooth right here, which will be removed in the bicuspid. That's the 6-year molar back in here. This tooth is up behind, and I'll get you a little better view of it over here. This is deciduous tooth that took out. This is the 6-year molar. The second molar is pushed up underneath the back side of the first molar in this area. Uh, this is the left side of the jaw. Nothing unusual. I'm not going to show anything about the orthodontics that we did after we got through with the cyst. Now the right side of the mouth would be this area in here, and this is where the cyst is, and I think this is the second molar that's pushed up underneath the 6-year molar. That view's not too good, but from this side you can see much better. The shape of the cyst is back in this area, and it's got this second molar that is crammed up behind the first molar, and here is the deciduous tooth right over the bicuspid, the first and second behind the cuspid and all this. So we'll look at it from another side here. It's not, won't take us but just a little bit to show this. Now this is just a little better view from of the x-ray. Now in doing this, the oral surgeon always injects empty needle and and aspirates some of the cyst liquid up into the base of the syringe and checks it out, makes sure it's not an abscess or anything like that. And this is a true cyst liquid that he's taken out here. And this is the way they go about this. Now this is your first molar right here. And of course this baby tooth comes out in this process. And the second molar, I see the top of it in here, is pushed up in underneath here. Now if I were doing this with the slow method, I'd open a pretty good sized hole in this area and pack gauze, or this was the method we did back then. We packed iodoform gauze. They may have some super duper better method of doing it now, but you just keep it open, takes the pressure away from this area, and the thing shrinks down. And when the pressure's off of this tooth right here, I feel like would have come in, because the little girl that we did the slow method on this morning, her cuspid was pushed up, had the roots stuck up in the sinus, and it came down and came in, and I didn't have to pull it down. Just fell into place there. So anyway, we'll go on here now. He takes this uh, cortical plate of bone, which is quite thin, out, and he peels the cyst out, and he feels like he has to remove this molar. And I would think that you wouldn't have to move it, but anyway, he did, so I'm not going to question what he's taught to do there. Now, this is in the process of doing that, and here it is. The cortical plate is gone, and he has removed the molar, which was in this area right here, and he has the cyst out and takes pictures of it, and they send it in for biopsy, and it just epithelial tissue, no cancerous thing or anything wrong in here. And he's got a flap now. He's going to pull back on suture this up, and it heals over, and bone fills back in the area. Now, but this person doesn't have a 6-year, a second molar. There was no wisdom tooth in there, so you got a problem. You'd either have to use the upper wisdom tooth to transplant it down there, or put an implant in later on to have a full complement of teeth back through your 12-year molars. Okay, here is the cyst itself, and this is the outside as best I know, and this is the inside is smooth where the liquid is, and that's where the liquid goes in, but it can't get out, and it keeps coming in, and it creates this tremendous pressure and pushes teeth around or anything. The bone swells out, and to fit it, the bone just kind of moves in front of it. This is after the biopsy came back and showing that this was strictly epithelial tissue. So this is all that we show on this. This is a much faster way to do it, and you don't have any responsibility of it, but I feel like it's much better, but it takes quite a long time to keep this gauze in, and every few days, or I don't know, sometimes you could go maybe several days without changing it. But I did this on patients before, so I talked to you about it in the other video, and I had one big as a hen egg up here in this man's jaw, and it finally just completely shrunk down, and we got the source of the cyst and got rid of it. There was a follicular cyst around an impacted cuspid. We took care of that. The cyst just disintegrated and came out. Well, I don't know, it did just shrunk up and became tissue around the teeth where it comes in. So this is really all there is to this video, and I hope you get something out of this. Thank you for watching, and I would like for you to join our group here and subscribe to our videos, and we'll try to keep doing this for a good while. So thanks again, and I'm going to close this out, and if I can get this over and stop it. So thanks for coming.